listen, if you're sick and tired of being sick and tired, guys, and you need a tiger back in the tank, well, I'm serious. It's not Viagra. You don't need Viagra. Nobody grew up taking Viagra. My mama didn't give me Viagra when I was 16 or 17 years old. Said, okay, be a man today, son. Here's your Viagra in the morning. No, sir. Guess what was going on in our bodies when we hit puberty? We got testosterone. Okay, so what's testosterone? It's the male sex hormone. And testosterone affects, first and foremost, your brain function, initiative, your assertiveness, your sense of well-being, your self-confidence, your moods, your goal, your drive, directedness, decisiveness, your analytical abilities. If a guy has low testosterone, and that can be people, they call it hypogonadism. Maybe they're born, they just don't have good development of their male organs, or they don't make enough testosterone. Maybe they have an injury, maybe they have cancer, and they don't have any testosterone. They can't think clearly. They can't do three-dimensional geometry. They can't read maps. They can't do math problems well. But if you give them testosterone, all of a sudden everything changes. Really? It affects your brain function. So testosterone, most importantly, it's a hormone that affects the neurotransmitters in the brain. So as you get older, I've had guys come in and tell me in their 40s or 50s, they go like, Doc, I just can't keep up with these young guys. I just can't seem to get it together like I used to. Well, guess what that is? It's a loss of testosterone. It also affects your muscle tone. So you see guys that get in the gym and, they're starting to look, their muscles get saggy and they say, I don't have the strength I used to have. And you see guys that don't even work out in the gym. You see them at the golf club. They're 60, 70, and they're pale and they're everything's sagging. It's low testosterone. It also affects cardiovascular function because your heart's a muscle, and it affects your muscle tone, whether it's smooth muscle or your skeletal muscles. It also affects, guys, your romantic moods and inclinations. You know what I mean by that? That's a nice way to say your libido. It affects it. It affects your abilities, your desires, and your abilities. So, the drug industry, Sam, has got all these guys in America thinking, oh, I must be low in Viagra. I need help. I need Viagra because I've got ED. No, sir, it's not low in Viagra. Well, you're low in testosterone. It's testosterone. And testosterone is a very important hormone that will help you think clearly, help your muscles be stronger, and help you have desires and abilities that you had when you were a young man.
See, one thing, Dr. Hotze is here from Hotze Health and Wellness around I-10 and Fry. Hotze, H-O-T-Z-E, Hotze Health and Wellness. The one thing I learned from Dr. Hotze, who's a great friend and pal, is that if you do a Viagra, you're not taking care of the reason. You're not taking care of the cause. All you're doing is fixing with a little Band-Aid action versus getting to the root of it, so you don't need to take that kind of stuff. Listen,
testosterone, as I mentioned earlier, you want to put a tiger back in your tank, that's how you do it. And let me tell you what I started back on it when I was 46. I started taking testosterone, and I also take it in combination with a little thyroid medication and a little cortisol, which helps your natural hormones be balanced out so you can continue to remain young and vibrant in your thinking, in your life. I got a 25-year plan. I'm 65. I got a 25-year plan I'm working on right now. I have guys that come in their 50s and go, like, I want to retire. I need to retire. I go, look, here's what I tell them. If I put you on testosterone, don't blame me if in 2 years you've doubled your income. Don't blame me.
That's amazing. And Dr. Steve Hotze, how do you take testosterone? Is it a needle, a pill, a gel?
You can take it. You can take testosterone injection on a weekly basis. You can take creams or gels on a daily basis. You can take oral medication. You can take it orally. I think the best way to do it is injectably, but creams work well. But you've got to get, let me tell you what. Compounded testosterone is wonderful. The pharmaceutical grade testosterone is usually very low dose, and it is extremely expensive, about $500 a month, if you can believe it. Whereas you can take an injection for maybe $5 a week.
And then what are any downsides when guys start taking testosterone? Is there any downside to having the testosterone injections or creams in the
Yeah,
body?
if you're in sales or own a business, your income goes up. You have to pay more in taxes. But so what? You're making more money. No, obviously, like anything, too much of a good thing is not good for you. You've got to take it in a physiological dose. Take it at the appropriate dose. There's no real side effects at all.
Outstanding. Good to have you stop by. And
Always glad to stop
you've got
by.
the energy of you're about a 35, 36-year-old guy.
I feel like I'm 18, I do.
That's a great way to feel. That's a great, blessed way to feel. Dr. Steve Hotze, Hotze Health and Wellness around I-10 and Fry. Go online, Hotze. Wrapping up hour 1. Thanks for stopping by, Doc.
You bet, bud.